Hello, everyone. I'm Jean Sachs, the CEO of Living Beyond Breast Cancer. As you may know, at Living Beyond Breast Cancer, our goal is to provide trusted information and a community of support. And today we're going to discuss some issues that I think most people are facing, which is anxiety and stress about more businesses, schools, vacation, travel, and other public spaces open up after more than a year of dealing with the COVID-19 pandemic. So I'm so pleased to help us think about these issues. We are bringing back, she's been with us before, Celeste Vaughan-Briggs, to help us manage these issues. Celeste has more than 25 years of experience as a social worker and now serves as the manager of the free breast and cervical cancer screening program at Thomas Jefferson University's Sidney Kimmel Cancer Center, which is right here in Philadelphia. She's also a member of Living Beyond Breast Cancer's Medical Advisory Board. And if you want to learn more about Celeste, please go to our website, which is lbbc.org. So Celeste, I'm so happy you're with us. How are you doing?
I'm doing well. Thank you so much for having me. How are you?
I'm doing pretty well. It's great to have you back. So throughout the pandemic, Living Beyond Breast Cancer has periodically taken the time to talk to experts about managing stress and anxiety and uncertainty during this really challenging time. And we know for those impacted by breast cancer, there's really a whole other layer of issues. So fortunately, more and more people are getting vaccinated. And I know in many communities, cancer patients have been prioritized. And we keep hearing about, it's returning to normal life. And what we're hearing from a lot of people is, I'm nervous about this. So Celeste, help us understand what might be going on for some people in regards to getting back into the world.
Okay. Thank you so much for having me to discuss this topic because it's so important. The COVID-19 pandemic in so many ways disrupted all aspects of our lives: work, home, school, and most importantly for cancer patients, their treatment, their interactions with the healthcare system. So even as we learned over the course of this last year, kind of what to predict, some guidance about what to do. It almost seemed as soon as we learned something changed. So that has certainly, I think, for many folks added to a layer of anxiety, discomfort, and unease. So a lot of emotions for a lot of people going through this pandemic, and for cancer patients in particular. So this is a very important topic. And I think the first thing is we're not alone. It is absolutely understandable and common to feel uneasy, even as we are getting guidance that things are opening up and for things returning to some sense of normalcy, to not be quite so sure what that really means.
Right. And of course, not everybody has sort of been managing this pandemic a little bit differently. So it's understandable that managing the reentry is different.
Yes.
So keeping up with your friends. So I know, Celeste, that you see people with breast cancer as well as other types of cancer in your practice, and you have been seeing them throughout this year. So what may reentry anxiety look like for someone who is also managing a breast cancer diagnosis?
It was interesting in many ways. Some of the same tools that we had to utilize to deal with the pandemic, uncertainty, unpredictability, changing guidance, and how we learn to manage that are some of the same tools that cancer patients already had in their toolbox, because with a cancer diagnosis, most people don't expect it. They're thrust into a new world. They have to learn a new language. They have to learn what the norms are for their behavior, for their family members, what to expect with new treatments, and that piece of uncertainty. So I think for cancer patients, one of the things that I remind folks is that some of these tools you have in your toolbox, we may need to shine them up a bit. We may need to dispatch them somewhat differently, but there may be some coping mechanisms and skills that they have that they've used to cope with the cancer diagnosis that can be applied for dealing with the pandemic and what reentry really looks like based on their individual circumstances.
Right. And we talked a lot about that cancer patients really have had to isolate and do a whole bunch of things that the general public has been asked to do. So what are some of the triggers specific to the situation that our community should look out for if they are invited to go somewhere or something is on their calendar and they're starting to feel anxious?
So I think one of the good ways to prepare for this is to, one, know yourself, where they say physician know thyself, a person know thyself, know what you're comfortable with and not comfortable with. And that would be based on your cancer diagnosis, your discussions with your care team in terms of recommendations they may have made to you, regardless of your vaccination status, in terms of how large or small gatherings you need to be interacting with, whether that goes to work, how often you go to work, with whom you socialize, do you socialize? So I think balancing the guidance that you've got from your care team and your own layers of dealing with anxiety. For some folks, it may feel very comfortable based on the vaccination status of friends and family, in which certain activities that they are okay with going to do. It could be following CDC guidance in accordance with the recommendations from their care team would be the only way that they would feel comfortable. But I think whatever they feel comfortable with is really the good starting place to be. Not to push yourself to do something you really don't feel comfortable doing yet. Even if other people are like, we want to see you. If you don't feel comfortable, it's okay to say not quite yet.
Right. So it's okay to say no, which I think we always give that advice. And I've heard from some people that, maybe start slow. So, maybe if you haven't gone to the mall yet, or you haven't eaten outside at a restaurant, like maybe try one thing, like don't try to do it all. Do you think that's good
absolutely.
advice?
Absolutely. One thing at a time and see how you feel. And make sure you have what some folks call kind of an out. So a way to excuse yourself, almost a regular script. You may have wanted to meet a friend in the park, but on the day of, you just don't feel quite so comfortable. So being able to have some language already ready to say, I'm not ready to do this yet. Whether you tell that person the whole story or a part of the story, to say that, no, I'm not ready to do this yet. And maybe start with a smaller step, maybe outside in your backyard first, as opposed to going to a venue like a mall.
Right. That's good advice. I know part of this anxiety is everyone trying to figure out what is your true risk. And I think you can read 20 different articles and have different information about you have absolutely no risk if you've been vaccinated, or you have this risk, or you have that risk. We know the clinical trials were not done on cancer patients for the vaccine, so we don't know if it's as effective. But do you think it's helpful for people to try to figure out their risk and then make decisions that way? Or what do you think is most helpful?
Well, I think what can be most helpful is a combination of factors, because part of any individual's risk assessment really ends up being very personal and then kind of going out in circles. So your first risk assessment is with yourself. Then it goes to others, whether that be your immediate family, people in your bubble. And then kind of out from that, your folks you have to interact with. That could be your treatment team. That could be work if you have to work outside the home. And then kind of a further circle out, maybe kind of the public at large. And It's okay to have different risk strategies for different parts of that circle, and to get consultation if needed from, particularly your care team. If you are immune compromised, the American Society of Clinical Oncology has dispatched guidelines to different oncologists. So they are up to date on the most recent guidance. So you really want to check in with them specifically, because they're going to know your profile, what your blood work looks like, what your treatment protocol looks like, and what you can have a more informed decision about your medical risk.
Right. I know I interviewed a doctor a few weeks ago who said, you need to remember that the CDC guidelines are really for the general public, not specifically for cancer patients or other populations. So that's really great advice that, talk to your doctor about it. So in what situations do you think someone should seek professional help if they're really feeling a lot of anxiety?
So and I'm a little biased professionally. I always think it's helpful to check in with others, but some of the things that come to mind where you may want to talk to your care team about a referral to either a social worker, a psychologist, or psychiatrist with the team, either internally in the cancer center or out in the community. If you're having problems sleeping, feeling like you're sleeping a little bit more than normal, a little bit less than normal. If you find that your eating habits have changed, even beyond kind of the eating habit changes that may have come with treatment, you find yourself eating more or eating less, you have weight gain or weight loss. If you are finding yourself in your interpersonal relationships having particular difficulty communicating, finding yourself wanting to be more isolated, kind of talking less to loved ones who you may have been normally talking with quite frequently, or finding yourself kind of a little bit more on edge, getting into conflicts more frequently with folks in your community of support where that really didn't happen before. Those may be signs that your level of anxiety, perhaps depression, losses that you've experienced along the way have really started to add up and impacted your activities of daily living and functioning. So you really may want to talk to someone about that and see what the best next steps could be.
Right. That's helpful. It's helpful to know what's different and do that check-in. And for those that, are not having as extreme side effects, but are just anxious, do you have quick tips for things they could do to just kind of reduce the anxiety on the spot?
Sure. So the American Psychological Association has some kind of general guidance, some evidence-based tools and strategies to kind of impact stress and our relationship with stress and anxiety generally. So these are a few good things. For the things that we can eliminate, try to do that. So kind of taking that personal inventory of things that don't need to be as stressful and putting that to the side, cultivating a good support network, finding ways to incorporate gentle movement into your everyday. Everybody's not going to go out and run a marathon, but you may be able to walk around the block. And that could be part of your trial of safe, socially distant activities that may, especially as the weather is getting nicer, it's a little bit easier to do. It could be also meditation and mindfulness. And we think about it as you have to be absolutely still and quiet. There are activities that can be meditative, that can be enriching and nurturing, like gardening, or walking, cooking, that really can help reduce our stress level and can be great things that we can add into our day that can make a world of difference. Little things adding up to big things and big changes.
That's so helpful. I always reflect on, we were asked to shut down so quickly. So we went from this very full life for some of us to, okay, now you're really in your bubble. And now that there's the opportunity, it doesn't mean we're then going to 100% change. And I think for some people, they've enjoyed maybe some of the having less activity. So I think it's okay to hold on to some of that, right?
Absolutely. People have found that there were hobbies and things that they had put down because they were so busy, and now that they took up again, that have really been enriching and purposeful. There have been people who picked up knitting and started knitting caps and sweaters, for newborns, and shipping them off, and feeling that, wow, this is an activity that I find personally relaxing, but I also was able to even give back to someone else. So we want to keep some of those things that have really been enriching.
Yeah, I'm an avid knitter. So any final advice, any final strategies that you want to leave people with?
One thing I would like to say is to give ourselves grace, to give ourselves a break, to be gentle and kind with each other as well, because we're so hard on ourselves, and sometimes the folks closest to us to be a certain way, that we're supposed to feel more comfortable. We're supposed to be more out there, but to have permission to be exactly where you are, because that's where you need to be in the moment until you can get somewhere else. And to be patient and gentle and kind with yourself. You deserve it, as does the persons who are closest to you.
That is so helpful. Thank you. I think we all need to remember that, whether you have cancer or not, but this is a good time to, give yourself a break and credit for what you are doing. So thank you so much. We always love talking with you. And we know that this is a marathon. It's not a sprint. So it's going to take time for everything to, people to start feeling like they can get back to their normal life, whatever that looks like.
Absolutely.
So thank you. And I want to remind all our viewers that if you would like to talk to another woman who's been diagnosed with breast cancer, we have a helpline, so go on to lbbc.org. We also have closed Facebook pages if you're more comfortable doing that. So again, log on and we can connect you with a group who can give you immediate support. So thank you for joining us, and stay safe and stay well.
Stay safe. Thank you.